Good morning. This is Christina with Forge Breast Cancer Survivor Center, or Forge Survivorship Center. I'm excited to be here with Madeline Harris and Kristen Noles this morning. Where we're talking about breast cancer as a family disease. And I've had the chance to get to know both of them through Forge, through volunteering, and just being a part of the community in Birmingham of folks who are working with breast cancer. And I not only have gotten a chance to know them personally, but more than anything, I think know more about them as I continue to read articles and hear other people's stories and the ways that they've impacted people's lives. So Madeline and Kristen, I'm going to actually throw it to y'all to please just take a minute which I know this is a really hard thing to do in just a minute, but take a few minutes to share a little bit about your story with breast cancer. And what that specifically also with your medical background and what that experience has been.
Well, Christina, first of all, thank you for having both of us. One of the real missions we both had was after going through this trajectory of difficult but also glorious times through the breast cancer journey, that we would be able to offer any kind of support and advice to others as they move forward. So I really appreciate Forge for giving us the opportunity to be together and share our stories. We have done it nationally and was videotaped, and I don't remember when that was in New York, but we've tried to do that, even though, you know, obviously I've gotten older and Kristen is very busy with her children. But anyway, I'm an oncology nurse. I've worked at the Comprehensive Cancer Center at UAB for 25 years and 1 month. I started as a nurse clinician, then became an outpatient hematology oncology manager, and then got my master's in oncology nursing and became the director of patient care for the Comprehensive Cancer Center. And then about the end, I think, of 1988, the Department of Defense had some money that they dedicated to breast cancer care research if you had a breast center. And so I was one of the co-founders of the breast center that is now the breast center at UAB at Kirkland Clinic. So I retired in that position in 2008. The highlight of being in that role was some of the physicians that I had such great respect for, but most importantly were lifetime friends who were survivors and their families that I am still very actively involved in. From there, I went to the School of Nursing and provided support in a rural breast cancer survivors study in actually Florida, and it's now located, the results of that study is located at the NCI. There's a publication about it. And then when I retired from there, before I retired from there, I was recruited to be chair of an advisory committee of the Women's Breast Health Fund at the Community Foundation of Greater Birmingham, and we began to offer grants to breast cancer programs, not research, but services in the 5 counties we serve. And I was recruited to be the director of that fund, so I was no longer a volunteer. And I retired from there in 2018. I spent the last 4 years of my life as a full-time caregiver for my mother, who died in March with end-stage dementia. But I've continued to volunteer. If you've ever been a volunteer or want to be a volunteer with Forge, I teach the part of the volunteer class training. And then I'm still a member of the Women's Breast Health Fund at the Community Foundation of Greater Birmingham. So thank you for letting me be here. And I'm sure Kristen's story is much more exciting.
Well, Madeline, thank you for sharing all of that, and just thank you so much for all the work you have done. It's been so meaningful. Sorry, Kristen, I didn't mean to interrupt you, but
no, you're fine. No, my mom is amazing. I've always said if I could be half the nurse that she was, then I'm doing really well. But I'm not here because of my professional journey. I'm here for my cancer journey. So I will say that I was a nurse leader at the time of my diagnosis, a little bit everywhere, all over the system. And so the day I scheduled an ultrasound, which my doctor, my OBGYN just did it because it was me. He told me, like, there's no way, you've had lots of kids, this is nothing to worry about. Even though at the time my oldest son had named this one visible lump that you could see when I tried on my bathing suit that sort of went around my neck. And he's like, Mom, what is that? Let's name it. And I'm like, oh, it's nothing. You know, my OBGYN, I didn't say OBGYN to him, but Dr. So-and-so said it's nothing. But we'll go ahead and ask for an ultrasound. And I wore scrubs that day, walked myself over by myself, went in. I can remember still to this day, looking over at the telephone, like, should I call someone? Something seems weird. I'm here by myself. And she just told me that I, need to have these biopsies. I'm like, whatever. If they're just doing overkill, I'm fine. And I can remember the look in the lady that actually like took the biopsies and put them in a specimen cup. That look just seemed odd. Like she knew something that I didn't know. And I remember, getting the ice and walking. They said, you might want to go out the back door of Kirkland Clinic. I was like, oh, whatever. Okay. Put the ice on, went downstairs. And this is after, I probably was in mammography a good hour and a half to 2 hours because we were back and forth making sure the markers were where they were. And me as a healthcare professional really had no idea. I just thought they were just being cautious. But I went down to the back doors out of Kirkland and I called my mom first and I said, Mom, what are you doing? She's like, I'm cutting grass. I'm like, okay. Well, guess what I saw today? And she's like, what, Kristen? Like, I'm cutting grass. And I'm like, I saw a total of 6 punch breast biopsies. And she's like, where are you working today? And I'm like, no, I had my ultrasound. And then they did biopsies. And she's like, what? And my mom went nuts. She basically started calling everyone she knew about how this physician was doing it just because it was spring break and that there was nothing wrong with me and that they just took advantage of the situation, which then in turn turned out to, okay, we're going to keep your birthday girls weekend at the spa, which that next day was supposed to be at the spa all day. And so there I was with this huge transparent dressing and my bathing suit in the hot tub and hanging out with my mom and my aunts. And we celebrated my 35th birthday. And then on the way home that day, I remember my 3 kids, I needed to go to the grocery store. So I threw my daughter for the first time ever into the Publix baby seat, that's like in the thing, which is so nasty. And I was just like, no, I'm just going to throw her in there. I don't have to deal with it. I'm going to go shopping. And I hit the bread aisle and I noticed on my phone, and I don't know if you guys do this, but if you don't you recognize the number, but it doesn't have a name attached, or the prep, like the first 3 digits and where that equates to, like, I know UAB's number, I know like Highland's number, like, so I see it, but at the same time, my mom was calling in and then my husband was calling in and I've got this kid that's like, I'm done. And I remember I probably should have called my mom or my husband first, but I didn't. I checked the voicemail and it was the radiologist that said, call me back. So immediately called him back. And over the phone in the middle of the Publix bread aisle, I was told I had breast cancer. And again, my mom was livid. But what was really amazing is the physicians that had known my mom for years, they like came into action. And that evening, one of the physicians that was actually the surgeon sat down with me and my husband and my mom and went over everything. And then by that Monday, that was a Thursday. On Friday, I was back in mammography. And then on Monday, I was meeting with my entire interdisciplinary team to start chemotherapy with my medical oncologist, who's on the call I see, Dr. John Carpenter, on that Friday. And I might be horrible with years, but with days, I can remember them like it was yesterday. And so I started chemotherapy on March 25th. And I had 6 months of, I might say this wrong, Dr. Carpenter, but it was adjuvant therapy. All I know is it means my tumors were big. One was really attached to the muscle on my chest wall, and I had several of them. So we wanted to shrink the bigger one to create space between my chest wall and the tumor itself prior to surgery. So every week I would work all week and walk over for chemotherapy on Friday afternoons and spend time on the weekends with my family until the next week came. And I will say during that experience, for those that have young children, we had to learn how to spend time together differently. So I'm a very active person. I was very healthy at the time of my diagnosis. I did not smoke. I did not drink except socially. I ate healthy. I ran all the time. And so all of a sudden, mom's tired. And so we read a lot of books. We did a lot of puzzles. We played a lot of games on the floor, because believe it or not, the floor is really cool when you don't feel good or you're nauseous. It's amazing. But from there, I had surgery. And what was interesting from that is, so after 6 months of chemotherapy, the chemotherapy treatment was successful. It had actually created space between my chest wall, and actually almost eradicated any known disease in the other 3 tumors, which was huge. So kudos to Dr. Carpenter for thinking of me as an individual and not like a textbook. It really gave me the best chance for survival at that time. And then I remember thinking, because I was small, and so there wasn't a lot of room, and Dr. Fix was my reconstruction surgeon, and he thought he was going to have to do a very extensive surgery to give me any type of female-like figure on my chest up until the week of pre-admission, literally. And I'd already, I done, oh, I forgot this, goodness. I did 33 treatments of radiation.
After surgery.
After the mastectomy, but in preparation for the reconstruction. And because of that, which a lot of people don't realize, is when you have the radiation, it actually causes your skin to tighten and shrink with scarring. And it can it burns you too, which also adds to the tightness of the skin. Hence why Dr. Fix, my reconstructive surgeon, was very concerned, because after 33 straight treatments, that was really to make sure that the cancer didn't grow back. It was really important that I had the highest quality of life for survivorship following, to spend the rest of my time with my children and family. But what was interesting, I sort of jumped ahead and I apologize, but it's probably because I try to take the most traumatic aspect of my crazy journey out of my mind. But after having my mastectomy, and many of you probably know, you have drains that come and drain out the blood and the fluid. At 10 days post-op, I'd had a visit, and they're like, "You're doing great. We could probably take out your drains, but we're just going to leave them in. You're healing so well. You're doing great. No worries." And so my mom talked me into riding with her, not driving with her, riding with her and my daughter, who was 18 months old, to my niece and goddaughter's birthday party. And while I was there, the JP drain actually eroded my pectoral artery. And I lost over 2/3 of my blood volume, and it was going back very rapidly. And I was out of the Birmingham area, and all I could do is pray. So my little game with myself to keep me going is that I was still in control if I could say the Lord's Prayer. And for those of you that are Christian, the Lord's Prayer is something you sort of grow up with. And so I knew it, and I didn't really have to think about it. And so as I show my mom, and literally blood is streaming into my JP drains, I'm just saying the Lord's Prayer. So I'm sure I looked like a crazy fool when we rolled up to the front of that hospital, and I'm saying I need an IV and fluids, and I need to get to AB. And they're like, "This lady just keeps on saying the Lord's Prayer." But it was a very traumatic experience for my mom and myself, because the hospital we were at, they actually just said I was agitated. And this was as my mom was draining blood from my JP drains in urinals, which are about 2,500 milliliters of blood, and emptying them. And until we were able to call a physician and someone at UAB to escalate the concerns rapidly, my blood oxygenation had descended quite rapidly, and I went from an ambulance transfer to a helicopter transfer. And when you don't have your kids with you and you can't talk to your husband and you don't know if you're going to live, it is terrifying. And I know for my mom, having to see that, it was terrifying. And just holding on to your life in a different way, where you were supposed to be surviving and beating the disease because you've gone through chemo and, you know, you're ready to tackle radiation and you can see a future, it's quite terrifying and humbling at the same time. But at that hospital, they didn't have a helipad at the hospital. So it was kind of like the ER is the best way I can, is a small hospital. Mm-hmm. It's like all these people that work there were lined up as I'm on the stretcher getting taken to the ambulance away from my mom, piled in. Then we drove to another site to get into the helicopter. And then I was flown to UAB, where I had a team of an interprofessional team, a team of doctors, surgeons, anesthesiologists, nurses, everyone that took me in and took me up to the OR quite rapidly. But I will say I received code gray blood during the transport, a total of 2 units, which if you don't know what that is, that's where they don't match the blood to the recipients. They just take a chance because you need it that bad to be able to have a chance to live. And what's interesting, and the reason why I share that, is because after I went home from the reparative surgery, I started swelling. And by that Wednesday, I went home on Tuesday, and the very next day I couldn't even get up from the couch. And I noticed that the baggy, like, pajama pants that I had, they were really, really tight, and I'd stopped urinating without realizing it. I spiked a fever, but as a healthcare professional, thinking I trust what's being told, I'm looking at my discharge patient information and saying, well, my temperature is not exactly that, so I don't need to call anyone. And then my mom came over with her knowledge and was like, no, we're going straight there. And I was transported from the outpatient side at UAB Hospital, which is Kirkland Clinic, via stretcher to an inpatient unit. And I almost ended up in the MICU for liver failure, which we finally figured out was related to a delayed transfusion reaction. Long story short, I'm alive. I am doing great. I'm thriving. My children, I will say, I wish there was more for children and spouses in the community that's real and welcoming and non-judgmental, because our family, to survive the experience of fighting cancer, our family continues to work to rebuild. And I couldn't even tell you, 9 years out? 9 years out, we continue to rebuild. My son finally disclosed when he was 15, he's 19 now, that he had to let me die to be able to function during that time. And so you can only imagine a kid that, one, he has severe ADHD, but he had to literally not have me in his life for 2 years to try to rebuild that. Has been quite a challenge. My middle son, he's now 15, and he is just a worry wart. As long as everyone's okay, it's not even just me. But if you nick yourself shaving and there's a little blood, I'm dying. And then my daughter, who right now, I have to say, she was 18 months, so she doesn't really remember the experience. But the new norm, like a lot of people call it, is very different. I look different from most females. So my daughter right now, she's 11. She needs to be wearing a sports bra. And this girl will not wear a sports bra because she'd rather have her nipples cut off. And that's the honest truth. And so that's the struggle we're dealing with and have been dealing with for about 6 months now. I take a daily Tamoxifen. Thank you, Dr. John Carpenter. He can probably speak to it more medically, but I will say that for me, it keeps me where I'm at the same risk for recurrence as anybody that never had cancer. Like, it just gives me the best chance to not have a recurrence. And then because that drug, and just like every chemotherapy agent I received, with this drug, it's like 50% of people, it doesn't bother them at all. It's like taking a vitamin. The other 50% of the people, it makes you crazy. Okay, I take another drug to stabilize my mood because I was ready to not take Tamoxifen because it made me so crazy. But I do take both of them, and I take them religiously every day because I feel like that's something I have control over. So that's sort of a summary. I will say that when I was diagnosed, I was told that I had sporadic, it was just by chance. And people would say, oh, it's because you drank Diet Coke, or, oh, it's because you spent time in the sun, I bet. I mean, just the most, they're trying to help, but they don't know what to say. But I will say, because research is always growing in this domain, that I was able to take a repeat genetic test 5 years later, and I do have a gene. And it's checked 2. It's not BRCA1 or BRCA2, but it's checked 2. And to me, that was very, I don't know, it was very empowering for me, because instead of telling my family that, oh, it was just sporadic, good luck to you, you're at a high risk, there are now things we can do if we choose to do. And that's for my children, and that's for, you know, my brother and my niece and my nephew. And my brother got tested, and we found out that it does not have that gene. So now I don't have to worry about my niece and nephew. So just things like that, that if you stay on top of things as a survivor, and you have wonderful healthcare providers and resources like Forge that can keep you advocating for yourself and your family, it really helps you thrive and feel like you have power versus being the victim of a cancer diagnosis.
Oh my gosh, Kristen, thank you just so much for sharing all of that. I mean, I think that the way that you just spoke to it, the way that you remember in such detail each of those days, just shares how impactful a diagnosis is and the journey that you go through with your family. And it is such a powerful story. Like, thank you for sharing all of that and for just being vulnerable with us. So I'm sure that's not always easy to share, especially because you have some elements of reliving it. So just thank you so much. That's really powerful. Now, I know that you mentioned that there were times in which your mother was livid during this experience. And Madeline, I do want to throw the question to you just a little bit. If you could speak a little bit more about what your experience was like being a mother to someone who was diagnosed with breast cancer.
It is very difficult, especially if you are considered or have been considered one of the breast cancer experts in the community from a nursing perspective, and I was somewhat of a case manager before it existed, and really worked with families. And one of the things I always said was, you're going to be fine. This is a disease that you're going to be fine with. So I took it really personally, in that part of my credibility all of those years was saying, oh, you're going to be fine. And then it hits my daughter, and it's like, well, I can't look at it any differently from that. But it is very, very different when it happens to you. Yes, I was livid, but only because I was livid with others that didn't get the type of care that they should. And they weren't my blood relatives. But when you're on the outside and you know better, and you see something that's not appropriate, if you are, sincere in the way you are, you speak up and you try to make things better for those that follow. I think one of the most difficult issues is, because I was so involved with breast cancer, and I did a lot of community projects. We had a group that climbed Mount Kilimanjaro, 20 years ago, to show survivors can do anything they want. It took us 2 years of training and fundraising to do that. Then we had a group called For the Cause, and we did adventures with survivors during treatment, and many other types of events for wellness and support. And so people could get out of that mindset of, I have cancer and I can't do anything. I mean, even if it meant oxygen on a plane going to Antigua, we got that person to Antigua, and they died within 3 months afterwards.
Wow.
But we did that, and unfortunately, but fortunately, my family was very intimately involved in those projects. So Kristen's oldest son, when she was diagnosed, was in third grade, third grade. All of her children were in a Catholic school system, and so his classmates, the teachers, the parents, that extended family really provided so much love and support, not only to him, but to the entire family. That was Kristen's care team. I'm actually wearing a t-shirt. I don't know if you can see it, but Kristen was having her mastectomy at UAB, and her room overlooked Race for the Cure, and her son and his friends, and I have pictures of this, and their parents from their church all were there in support of her. 2 survivors, very wonderful lady, well actually 3 now, ladies that traveled with us and worked with us. Nicholas was very close to. Violetta Caceres, I don't know if y'all knew her. She was a doctor, an ophthalmologist, was married to an ENT. She was from Puerto Rico, and she was called the Pink Lady because she was always the largest fundraiser for Race for the Cure. And so he would go like to soccer games and raise money with her, and he knew her well. When Kathy Kemp, who was a reporter with the Birmingham News, she won the Life Inspiration Award or something at Coleman, and she got her award in a wheelchair. Nicholas was there. Nicholas, when I'll never forget, here he is, 8 years old. He went up to her on stage, and he was hungry. So he went up to her on stage and said, "Can we go have chicken fingers?" I mean, because he didn't perceive it as, he saw her as who she was, although that was a month or month and a half before she died. And then a dear, dear, dear friend who I really, Jan Bola, who I send so much respect and love for. She was one of our first patients in the breast center, and she wanted to provide something bigger and better for those women who were newly diagnosed. And she started a program called the Angel Squad. It's evolved over the years, but Jan was picking my brain every time I was with her on things that we should do that would make it better. And yes, Dr. Carpenter was her doctor as well. But Jan, she, of course, they all knew her, and she lost her battle. So we still have a group of women. We just lost someone last year, and you may have seen her video. She was very involved in Forge. Sally Grawl did her last radiation treatments for metastatic disease in a princess outfit, which she would wear wherever we went. When we celebrated, we went to the club one Christmas, and under her little mink coat was a pink, what are those things? Not a camisole, but they're like girdles. What are those? You know what I'm talking about. And she took her mink coat off in the middle of the club and us having dinner. And that was the kind of things that got us all through it. But cancer is a family disease. It is. And, you know, over the years, I've seen so many very sad things with husbands talking to their mistress on the phone at the nurse's station while their wife is dying in the room. Horrible, just very, very sad things, because it is so difficult for families going through it. Kristen's son, actually, Nicholas, lost a couple of years because he was loved through her diagnosis, so his teachers didn't make him do homework. The dog ate his homework. He forgot his notebook. Well, Nicholas finally had a teacher, an older teacher, like when he was in 5th grade. And he had never been tested for ADHD, but she had his number, and she made him sign a contract on what he was going to do and what he was going to produce in November. Well, in December, during Christmas break, she died of a blood clot after a knee transplant. So she was very healthy. In October, prior to her dying, his father's grandfather died suddenly of a heart attack. So he lost him. So there was so much loss in that family. I will say that through Forge, or it was Forge then, or maybe whatever it was pre-called for that, but it was Forge. Forge was able to help them through counseling at Oasis, which was phenomenal. Because they did it as a family and they did it individually with the children. This was prior to them having the adolescent program. But what was so interesting is Kristen's middle son, who is just a brain and then some, the way he coped with her disease when he was 5, he wrestled with, the little wrestle figures. So he acted out his anger and his being upset through them beating each other up. And if you go into the Oasis, when we can go into Oasis, they have a great room for the therapy for children. And it's action figures like that, so they can actually fight out within themselves, and it starts conversations. So we didn't realize that we were beginning to become concerned about him, because we didn't know that was great that he was doing that. So but it is it's a family disease. He's now my ex-husband, but her stepfather, he wanted her to quit work. He'd pay for the children to go to school, he'll pay for their house note, just quit working. Well, Kristen never missed a day of work through her treatments, except when she was in the hospital. She took her chemo and recovered in time to go back to work on Monday. Much better than me, because I wouldn't have done all that. She finished her master's program while she had gone through treatment, during treatments, and then after treatments, she came to me and said, "Mom, I want to be a doctor of nursing." I told her she was crazy. Well, she is now a doctor of nursing because she graduated 2 years ago in August. So she has not let it stop her at all. But she is very, very active, and you have to find your niche through the survivorship journey. But just know every family is different. But there's some underlying issues that every family faces, and I'm just thankful that Forge is there and their list of resources to help other families go through this. And it's long term, it's not just during the treatment.
That's true, and that's something that Forge is committed to, is working with individuals from day of diagnosis through balance of life. And that's been part of our mission. That's one of my it's most meaningful, I think, to me. And that does bring me to another question for you, Kristen. Knowing you had so much going on, and when you received your diagnosis through treatment and through work, through being a mother, a husband, a daughter, and you spoke into this a little bit, but what were some of those balance coping mechanisms that you found that you maybe continue to use post treatment and diagnosis while your family is still, like you said, rebuilding? But what is some advice or thoughts you have for people who are learning to cope and still strike that balance?
So first and foremost, I can honestly say that I really sucked at balance when I was diagnosed. It was almost like I was on a mission to change the world. I don't know how to explain it. When the chief nursing officer at the time, I was working on my master's degree when I got diagnosed. And so I had a meeting with her the day my team met. And I'll never forget it, because we were meeting around 10:30. And I told you it's weird that I remember days. I'm horrible with years. But I took my nuclear medicine. I was supposed to be doing my bone scan, and they wanted to put a patient band on me. And I made them put it on my ankle so I could hide it under my boot for the meeting, because I didn't want to be seen as a patient, or I didn't want to be seen as weak. But when I met with her, I basically said I would step down from the role I was in, because she really had led the way to make nursing be visible and very strong. And she told me at that moment that, no, I want you to stay right where you're at. And I want you to have every opportunity to be at the table in the boardroom along your journey, to remind us that the decisions we make are about patients. And so telling me that at the beginning of my sort of experience with chemotherapy and radiation and surgery, it made it, for me personally, it made it bigger than me. I felt that from my calling to be a nurse, but now being a patient, that I've just gotten permission to be an advocate for patients of all kind in the system.
Yeah.
So for me, that's what kept me going. I will say that in retrospect, I used to kid about it, whatever day it was. I wish I would have used the C card, which is the cancer card. But really, I don't. I really don't. What I've had to teach myself is to take care of self.
Yeah.
And so the things, if you're going strong like that with a mission that's greater than your own, and you don't have that balance and you survive, at some point you've got to stop and take a pause and say, okay, what about self? And I can say, honestly, I'm there. I'm so there. I love to read. I'm kind of a nerd. My mom said I continued with school, so I did all of that. And then it was like, wow, I can read books that I care about.
Yeah.
So I'm an avid reader. I don't watch a lot of TV. My mom just shared something with me, and I'm like, I don't know, was it on the news? I haven't heard about it. But I do think that helps with my spirit, because sometimes we can be very jaded from the media and what we're listening to that can take our core and change it, or at least have influence on how we feel on any given day. But I enjoy my children and I enjoy the outdoors. So I love nature. I love water. I take time every week to either just, even if it's hot or freezing cold, to sort of cuddle out on my porch if I can't get outside to do something at a lake or the beach, or just being outside with nature. After chemotherapy, it sounds kind of weird, but I can honestly say that I saw things more vividly and more, I don't know, more notice things that before I just kept on going and didn't notice. So like finding a butterfly in a bush of flowers, and it's like so vibrant that I want to take a picture of it, even though it doesn't turn out. But it's just, I want to be able to share the bluest sky I've ever seen, that you can almost like feel the positive energy coming from the sky, and taking those pauses in everyday life to be grateful for that. That's what I do now. It's nothing really awe-inspiring. It's just I embrace life and I embrace the gifts that we're given every day.
Well, that is very inspiring. That is so inspiring. Thank you for sharing that. And I have kind of one more question for each of you before we kind of stop our recording and move into our conversation portion. But I am curious to know from both of you, what advice would you give someone who is newly diagnosed? And that can be the person who is diagnosed or to their loved one. But I would just love to hear what kind of advice you would like to share with someone who is diagnosed recently.
Well, I have a saying that I truly love, and it's something that when I've presented other places, I always incorporated it somewhere, but it's so true. Hope means that help is available. So my advice is reach out for help. And now that we have help in the community that's free and resources that are available, most of the time, even if it's a nurse or a physician, when they're hit with a diagnosis, they don't know those resources, much less the layperson who's just been, sabotaged with a disease, the big C, which even if it's a great breast cancer to have, if there are any, and it's got a great prognosis, it's scary. They've heard that word. So don't hold it in to yourself. It's so difficult when you don't share that with a loved one or a family member, and have those difficult conversations when you're ready. Reality is, I may not be here tomorrow. I hope I am. I pray I am. But once you're born, you're going to die. And to have those conversations so your family knows what you want and how you want it handled is just so, so valuable. And I know Forge has got many resources on how to have that happen, because you don't want that trauma as well. So I just reach out for help. I think that's so important.
Thank you, Madeline.
Well, and for me, I think I would have two things, one for an individual and then one for a mother and a family member. I think for an individual that's faced with a diagnosis, like, don't be a victim. Like, that victim mentality, it will just weigh you down, and you're giving into cancer. And now, there weren't the resources when I got diagnosed, but luckily my mom was intertwined in the breast cancer community. So I had my own love army that I could reach out to. I had people advocating for me that I didn't even know were advocating for me.
Yeah.
And now you have like Forge, and you have your amazing healthcare team. Like, don't be a victim. You do not have to fight this disease alone, nor should you. And I think that's really important, because as I've seen programs and support groups and just different things, there's so many more people that have been faced with a breast cancer diagnosis that don't participate. And I just feel for them, because they have these resources that can really help carry the weight of their cross facing cancer if they let them. And then for those with children, don't hide your feelings, don't hide the disease, share your journey with them in time, because they have feelings too. And as hard as that is, now there are things like Oasis that you can facilitate. Maybe there's a minister, someone that you trust, that can help facilitate those conversations if you don't feel comfortable. But there's also a lot of really silly, fun books that can stimulate those conversations at different age groups. And I didn't have access to all of that. And I can say that trying to rebuild my family and those relationships has been a huge challenge, that if I had that support, I feel that we could have collectively hurt, had pain, been mad, and grown along the way until waiting till after I survived. And so that's really it.
Thank you so much for sharing that. I think that just speaks so much, once again, to your story and your journey. And I really appreciate your honesty of saying you're 9 years out and your family is still rebuilding. And I think that that's just such an important thing to remember, that even though a diagnosis may feel over, the memories are never over. And you're always having anniversaries, even if they're celebratory, they're memories. So thank you guys so much for sharing that. And I'm going to stop recording so we can move into some time for conversation.